Hello and welcome to our fourth webinar in our series linked to the procurement partnership toolkit that we produced at E3M. It's really great to see so many people here today from local authorities across the country and from social enterprises and other organisations that are interested in taking a relational approach to commissioning. We're in a time, I think, of major challenges for public authorities. We have the consequences of COVID, the impact of that on people and communities, and some of our poorest communities especially. We've got inflation, and not just the issues to do with fuel costs rising, but really across the board that again is putting a squeeze on people and on organisations. And that's leading to pressures on services, be it children's services, adults or public health. There's more interest now really than I think ever in taking partnership and relational approaches that can really harness the potential of social enterprises and working with social enterprises in the wider social economy. And so today what we're going to do is we're going to look at some examples of how this has really worked well in practice and made a difference. We're going to take a little look at the contracting side and how that can be more relational. Very often it's not. It's very focused around market transactions. And we're also going to hear from a leadership perspective from a council leader, and then we'll have a chance for you to ask your questions and for us to have a bit of interaction. So really looking forward to this, and I would like now to go straight over to our first case study, where we're going to have Rachel Silcock, who's Community Empowerment Operational Lead in Plymouth City Council, and Mark Rowles, who's CEO of Four Greens Community Trust KIC, and we're going to hear a bit about the work that's happening down in Plymouth. So over to you, Rachel.
Yes, thank you, Jonathan. So I'm going to talk very briefly through two journeys that we've taken in Plymouth, which are what we consider to be, examples of relational commissioning. And then Mark's going to follow on and talk about his experience as a provider of one of those services that's been involved in those journeys. So next slide, please. Yeah, so the two journeys I'm going to talk about very briefly are, the first one is the complex needs system in Plymouth, where we went through a process which was to develop in partnership an alliance, which ended up in an alliance procurement process. And then the second one is working with our wellbeing and prevention system, and where we co-designed and co-produced some wellbeing hubs. So two sort of similar types of journeys, but ending up in slightly different places at the end, just to give you two examples. Okay, next slide, please. So in terms of the complex needs system, the historic picture in Plymouth a few years ago, before 2019, was that we had separate commissioners, so public health, housing and social care commissioners, holding over 20 contracts with separate providers. So that meant that every contract had separate objectives and outcomes. They were being monitored separately. We didn't have a clear picture of the needs, all the outcomes, everything was done by separate commissioners. And the other thing, I suppose, that's probably more important is that the people who were using services, depending on where they turned up, were given a label. So if they turned up at a drug service, then they were seen as somebody who needed support with their drug use, whereas they might have had lots of other issues as well, mental health, alcohol, and so on, homelessness and so on. So they kind of became owned by the service they presented at. There was limited join up across providers, and obviously clients were being supported by various different services as well. So this all impacted on the experience of people using those services. Next slide, please. So we define complex needs, just to clarify that, as people with substance misuse issues, mental health, homelessness and offending. And we went through a long process, 5 years, over a long period of time, where we did quite in-depth engagement, obviously with people using services, with the staff, with the wider system partners, with people who became elected representatives. And that process of engagement started really with a really open kind of question about what are we trying to achieve for people, and through that engagement it gave us a prospect of a whole system of services that could be designed around the needs of people rather than a fragmented market which is basically really was only serving the needs of commissioners and the services themselves. So through that whole real kind of all those in-depth conversations, we came to a picture of a fragmented system, and that we could bring that together, and we agreed that we would do this as an iterative process. So rather than thinking that we could come up with the solution that we would just implement, we would actually do this through a process of change over time and learning and feeding back with stakeholders throughout the whole process. Next slide, please. So the key messages that we got from our consultation were that we needed to deliver transformational change. We just couldn't stand still, and any change really would be progress. And we had to let go of all the old processes and roles that we'd become used to. And we had to really create a collective vision and a collective and shared vision and become a real collective. So it wasn't a question of that we were going to, as I say, continue in the old way of working. We actually wanted to create something together, and that this was all about people, and we wanted to create a seamless system in which nobody could fall out, fall between services. But we knew that this is obviously a complex set of problems which need complex solutions, so it has to be a really flexible system, and it has to be able to change according to need. Really key to this is the relationship of trust. So the idea that in the past you might have commissioners who held the purse strings, who thought that they were responsible for creating, designing services, that they were responsible for making sure that things were done properly. This kind of way of working just wasn't working for us. So developing relationships of trust where we could all think differently, but also where we weren't going to judge each other in terms of thinking that people were failing. And actually what we wanted to do really was kind of fail fast and learn. So let's try things. If they don't work, let's learn from that and move on. So the ideal system just means that we all have to be committed to taking action. Next slide, please. So just to be clear on what an alliance, so an alliance contract, it's a vehicle. It's about sharing risks so that everybody in the alliance system equally shares the risk of things not working, but also shares the responsibilities and the opportunities. Commissioners and providers are equal members of the alliance. So we have an alliance board which has members of the providers and the commissioners sitting on it, and we're all equal members. And it's a way of working that's based on alignment around outcomes and a commitment to principles and behaviours. It's not a legal entity. All the participants retain their own identity and their own internal controls. One of the things we learned was that we had to make it really clear with individual organisations what the commitment was, and that all of the organisations had to understand that, because otherwise it just doesn't work. The systems would be a system where decisions will be made collectively about resources using the best for people, using the services principle and the ability to respond flexibly to needs. So you get rid of all those contractual boundaries and you're able to work together collectively. Next slide, please. So just so progress to date. So I said that was a very quick run through, but the progress to date, the alliance procurement took us about a year. We did go out to tender, asking for any alliances that wanted to bid for the contract. It resulted in one Plymouth Alliance contract, which started in April 2019, with 8 providers, who were all local organisations in the city, who've been working together, as I said, for 5 years, really to generate this new system. And it is a new approach to contract management. So we share problems, and we also really importantly measure what we value. So it's about having system measures based on individuals' experiences and how they feel as part of the system, both users and staff. And it really gives you the ability to remodel services quickly because you're working together. We've had co-location of staff. We're creating a shared database, but really importantly, there has been some real success. So there has been an increase in independent accommodation units. There's been a reduction in numbers of rough sleeping. There was before COVID a significant reduction in the use of bed and breakfast. That obviously has gone up during COVID, but it actually started from a lower base than it would have done previously. So that's the kind of where we are with the Alliance. Next slide, please. So now I just want to move on to the Health and Wellbeing Hubs. So this was a response to the aims of our health and wellbeing system. We have we had 4 aims, so obviously they're there to improve health and wellbeing outcomes for the local population. A really key one for us is reducing health inequalities in health and wellbeing, because in Plymouth we have significant health inequalities geographically across the city and between different groups. And whilst those were getting better, we know that the impact of COVID has actually been to make those worse. To improve people's experience of care and to improve the sustainability of our health and wellbeing system. Next slide, please. So we decided, we basically started off 2017, where we just had some open workshops where we were asking the question, how do we bring resources together to tackle health inequalities? What does that look like? And we were sitting in a room with many people from the voluntary community, social enterprise sectors, public sector, etc. And we was basically thinking, well, there are people in this room who just have no idea what's actually out there in the community, what resources are out there, and they don't really, so we had GPs standing up and saying, we don't know what is available for our patients. And we knew that in that room there were lots of organisations that were providing solutions to those problems, but there was just no connection between the two. So the idea of Wellbeing Hubs kind of emerged from those discussions. We then started a process of looking in depth at needs in the city across different geographical neighbourhoods, mapping assets and selecting potential wellbeing hub options. We went through a big process of public consultation. We talked to people in neighbourhoods, communities of geography, but also communities of interest. And this resulted in a kind of idea of a core list of services that would be based in our wellbeing hubs. And then we made a final decision on how we would work with, which VCSE partners we would work with. And in 2018, we went into the launch of our first hubs, and in those 2 years before COVID, we launched 5 hubs. We did actually go through a process as well, working with the Leadership Centre, who are an organisation that provides systems leadership support. And we did a probably longer than 12-month really program in the end of in-depth design work, which again included going back out and talking to residents to understand what wellbeing meant to them. So I think it's really important to emphasise that we, throughout all of this process, we've done a lot of talking and a lot of thinking about the purpose of the wellbeing hubs, and it again has been a very, very iterative process. I'm sure Mark will probably comment that we've kind of reviewed and reflected on our purpose several times over the last 5 years. Next slide, please. So the idea was we would create a network of wellbeing hubs, 3 different levels. The universal level was really going to be any places that anybody went for help. We were going to support those universal organisations by providing information and training. The targeted hubs, which are the building-based ones, where people were already going. So this is why we selected particular partners who already had resources in communities, buildings, where people were already going, and we could just sort of build on that and develop those into what we saw as our wellbeing hubs. And then the specialist hubs are where we have a full range of health and social care and other services. We're in the middle of developing one in the city centre in Plymouth, which is going to have 3 GP practices and some hospital services and other services in it as well. Next slide, please. So, as I say, the aims were that the targeted hubs would support the local universal network, but they would be a focal point for services responding to the needs of people locally. But we would try and co-locate services in those buildings depending on what the needs were. And this just gives you some idea of some of the examples that came, but this all came out of consultation. So the idea that people would want advice and information, healthy lifestyles advice, volunteering, on all those things that are listed there. Next slide, please. So just the last slide on my description of what the 2 journeys, and then I'll go on to talk a bit about what I think the strengths and weaknesses have been. So the outcomes and impact of the Hubs programme has been that each hub has adapted to the need in its neighbourhood and provides a fairly personalised offer to the people who drop in. So really, people come in aged 0 to 100 and they have individual needs, and staff in the hubs will respond to that. We have reviewed recently what the key issues are, and they are those that you would expect and that we thought they probably would be in the beginning, which were the issues around debt and benefits. Food aid has obviously become a big issue during the COVID pandemic, particularly mental health issues and health improvement. A significant number of people, just taking a 2-month snapshot last year, 835 people walked into a hub, so that's not during those 2 months. That was not even phone calls, emails, all the rest of it. And we have got some data showing that there have been improvements in people's satisfaction and reductions in anxiety. So I think the hubs would describe that they started off focusing perhaps on vulnerable groups, but actually, because of increasing levels of support that are now available, we're moving more towards a kind of community development phase. So next slide, please. So just to round up, I've got a couple of slides just to talk about what I think the benefits and challenges are really of relational commissioning. So the benefits, I think, have been that we have worked, with local organisations who know their communities really well, and who are also familiar with and familiar to local users of services, and that's been really important. You're not starting from scratch. You actually, they are the experts. They have the local knowledge, and that's really important. I think it does actually create some stability for the voluntary and community sectors, because I think if you can work with them and go on a journey and develop projects and services with organisations, then that as my last point on that slide, it kind of avoids the sort of competition that we see, which can be damaging and ends up with organisations spending a lot of time putting in bids and tenders which don't necessarily result in any outcome. And obviously, as I say, developing robust solutions. Everybody is an expert in some aspect of the system, and local organisations are particularly experts in the needs of their local communities. Next slide, please. I think this is my final slide. So obviously there are challenges. So you could be accused of having favoured providers. So it's really important to be open and transparent with everyone about which organisations you're working with and why, and kind of having that open dialogue about what their strengths are and their expertise are in the system. I guess there's a question of where does the power lie, and again, I think if you're by using an alliance model or a partnership model, that helps to define where the power lies and create some sort of equality. But I fully accept that it's often, it takes quite a lot of energy and work to get to that stage, really. And you could also say that working in this way with commissioners may stifle innovation from organisations that are kind of out there wanting to do things that commissioners haven't even thought of. That's why it's really important that we're all open to being challenged, that people can make challenges, and that we take an iterative approach and try things out, and and that we allow ourselves to recognise that we don't know everything, the solutions to everything. And I guess the final point, which I'm sure Julian will talk about, is about pushing legal boundaries. I guess that sort of point about what point can we kind of get work in this way without becoming outside of kind of legal processes, really. But I'm hoping that Julian will have some of the answers to that. So I think that's the end of my presentation. I don't know if I'll hand over to Mark to come in.
Hello. Yeah, hi. Thank you, Rachel. Sorry, my name's Mark Rolls. I'm the CEO of one of the Wellbeing Hubs that Rachel spoke about in her presentation. And I was just asked to give a few words about my perspective from the joint commissioning processes which Plymouth have been adopting. I think it would be useful just to say that my background is quite varied. I've been a sports development officer, children's centre manager, and a youth worker. And the reason I say that is because, and also in Plymouth all my life. And the reason I say that is I have for years been working with a variety of differing commissioners. And interestingly, each of the commissioners at the time felt that their particular area was unique. So if I was working with children's centre manager and commissioners there, it was all around the impact, obviously, on families and so on. But I honestly think up until the last 5 or 6 years, the commissioners and also organisations from across the sectors didn't really understand that actually all of our work in the community is very simply defined as trying to improve people's lives. That's the reason why I've worked in this industry, and I dare say many other people on this call have. And it is so frustrating when you used to work as a youth worker and you knew that as youth workers you would have a difference on adults' mental health, for instance, because if you improve the lot of your young people, but nobody seemed to understand that. And so when you were commissioning and you were going for funding, it was really difficult to actually do what your community wanted. And it was interesting about something Rachel said about knowing her community, because actually in the old days you used to write the bid and they thought they knew the communities because they looked at statistics. Well, statistics only tell you a little bit about the community. And now with this approach whereby now we share with Plymouth City Council all data and so on, so you've got what I consider to be a bottom-up model, therefore you are now seeing that things that are being commissioned now actually do reflect and relate to the communities that we actually serve. And I think the thing that I'd like to highlight is that I've worked in the same North Plymouth community for the last 30 years in various guises. And the three main communities or neighbourhoods have been always between number 5 and number 8 in terms of being the lowest social deprivation indices neighbourhoods in Plymouth. So over 30 years, of all the money that has gone into these communities, those communities have not changed in terms of their overall relationship with the rest of the communities in Plymouth. So therefore something has to change, or something had to change. And I genuinely, I feel I'm an old man going, oh, in the old days, but I genuinely believe that this is a once, and I was going to say once in my lifetime opportunity, where actually genuinely we are starting to work collaboratively together to improve the lives of those most vulnerable in our society. So interestingly, in the past, a commissioner, sorry Rachel when I say this, but a commissioner was just a named person and was sometimes held in this ivory tower as, oh, this is the commissioner you need to see. The interesting thing now is as you get together, it's like families. You know, your families will quarrel, families will argue, families will disagree, and Rachel will probably on quite a few occasions hold her hands in her head or head in her hands when I say something. But at the end of the day, we have a relationship which I hope is built on trust. And I know that I speak for other partners in that process, that now that we do seem all to be on what I would argue is the same side. Also, partnership is not just a word, and I'm smiling here because I'm hoping some people know what I mean. But when I used to write bids 8 or 9 years ago, or 12 years ago, when the sort of let's work in partnership was the model to move forward on, all you did was you phoned somebody you didn't know, asked them to put a letter of support in, who they said they would do it, knowing that you would get the funding, and they would just do it as a partnership bid. I'm not being cynical, I know that used to happen. The great thing now is if you're working alongside commissioners, you're working alongside the councillors who are also quite heavily involved in this process, then basically you're starting to get what I call genuine partnerships and genuine understanding of the issues. Some voluntary sector organisations have struggled with this, because at the end of the day, a partnership doesn't always mean that you split the money 8 ways if it's just about money, or you split the resource. And so actually what you're seeing now is the true partners, when there's 500,000 on the table and they're in an alliance like Rachel talked about, where some of them will go, look, we're not going to actually touch any of that, because actually this money needs to go to another provider in the alliance who's got far more of a better dealing and handling of the situation concerned. And so that's been a real shift, because in the old days it would just be about how you divide the money and how much money you can get. I will say, and I must credit Plymouth City Council, because they have had a really open process in terms of allowing the voluntary sector to be part of it. And I don't think that there's people in Plymouth who wouldn't say they've had that opportunity to actually be involved in this consultative process. And Four Greens is a community trust. We get very little money through commissioning, and the reason I'm saying that is I'm not here because Rachel's given me 500,000 to run the wellbeing programme. I'm here because I can see that there is a genuine way forward now in commissioning. The key thing which Jonathan said earlier on is that we have to nowadays react quickly to the ever-changing situations that we had. So over a month and a bit ago, before the Russian invasion, nobody would have known what would have happened to petrol prices and the massive impact that that is happening in that of energy. It is no good waiting then for 6 months for the commissioners or the councils to suddenly try and put together a package for commission funding. What has to happen is that the sector works very closely, instantly, picks up the phone, has meetings whereby we can divert funding to places and people who are really in need. And that is what is happening and has happened through COVID, but is actually now carried on out of COVID. And so the funding, we've got a huge social isolation problem in our community, and we have been able to access funding very quickly because we've been able to show the changing need that's been around. I think I just want to finish with a couple of things. I'm conscious of time, and we said we'd be 20 minutes between myself and Rachel. The Wellbeing Hub and voluntary sector should only be a means to an end and not an end in themselves. So people who come and access our service at Four Greens, I don't give a damn who they see. I just want to make sure that they have the opportunity to get the best service possible. And this goes back to co-location. This goes back to sharing capacity and sharing resource. And what is happening in Plymouth now is, instead of every wellbeing hub deciding to appoint a wellbeing manager or appoint a mental health worker, whereby there's not the capacity for it full time, we're now sharing the resource, so different people are coming into the centres each day. And I think the last thing to say is about, there was a couple of things you said about, does it stifle innovation potentially, this thing? Not at all. It's quite the opposite, because actually it's enabling the voluntary sector and other partners to actually go to the commissioners and go to the city council and say, look, this is what's needed. Why don't you try this? The other thing is, have we failed in certain ways? Yes, we have, because we tried things and they haven't worked. But in the old days, if you went for a bid and you didn't manage to achieve the bid the way that the commissioners wanted it, that would probably preclude you then, deep down, you'll preclude you from other bids and so on, because the councils would look and go, well, they didn't deliver on that. This is about new system. This is about changing the model so that we're all seen as one and we're not seen as commissioners, city council, voluntary sector. So I think what I am trying to say in a roundabout way is that this has been quite transformational in Plymouth in terms of this approach to change people's lives. And at the end of the day, the way I will judge it is the fact of when people are walking in the door, and we've had 3 that have walked in the door in the last 24 hours because they are working, but they now cannot afford to put food on their table. That's what we're all having to work with, and we'll be working with in the next few weeks and months. We have to have a system whereby it's responsive, we're all in it together, and that there's a level of honesty and trust to enable the minimal resource that we've got to be maximised. And I am imploring other people listening to this, if you are unsure about a commissioning model and joint commissioning, then please pick up the phone, speak to people in Plymouth, speak to people like myself and others, because it works and it is making a massive difference to those most in need in our community. Jonathan, I hope that's okay for my 10. I'll obviously take questions at the end and everything else. Okay, mate?
That's fantastic. Thank you both, Mark and Rachel. And if people have got questions, I've seen that we've already have a couple that are in the sort of questions bit on the system. You can type them in. We'll take all the questions together at the end. And if we kind of run out of time, then we'll make an effort to try and answer those questions and send you them by email or in the newsletter. And there will be a recording of the whole session that people can look at as well on the E3M website in the toolkit section. So now I'd like to kind of move on to hearing from colleagues in Croydon and the One Croydon Alliance and the Healthy Communities Together programme. So let's hear a bit about that.
Thanks, Jonathan.
And I think it's Bianca Byrne, who's one of the commissioning directors in Croydon. Unfortunately, I think we've got an issue with her camera today, but you'll be able to hear Bianca, and I think her colleague Laura is also going to be taking part. So over to you.
Thanks, Jonathan. It is Bianca here, and I still don't appear to be able to get my camera on, so apologies for that. But thank you for inviting us to come and talk this afternoon about our Healthy Communities Together programme. As Jonathan mentioned, I am the Director of Commissioning, Improvement and Policy for Croydon Council, and I have my colleague Laura Jenner here, who's the Deputy Director of our One Croydon Alliance. And I'm going to hand over to Laura to take us through the first couple of slides. Over to you, Laura.
Hi, good afternoon, everybody. Yeah, so I'm Laura Jenner, I'm Deputy Director of Croydon Alliance. Can we go on to the next slide, please? So first of all, I'll just give you a little bit of a background on Croydon. So we're a really diverse borough. Over 50% of our population actually come from non-white background. And we've got some real pockets of deprivation. Some areas we're in the top 5 deprivated areas in the country. But equally, we have got a very vibrant town centre. We've got a big business district, and we've got some amazing green spaces. And this is really why Croydon is a really good place to develop the Healthier Communities Together programme. We have got a really vibrant voluntary sector and brilliant community spirit. And also Stormzy comes from Croydon, so give you an idea of the culture that we've got. Okay, next slide, please. So alongside having a vibrant voluntary sector, we also have the Croydon Alliance. So this is similar to what you were just talking about in Plymouth. So our alliance started in 2017, and it's made up of health authority, local council, our mental health trust, our GP federation, and currently Age UK. And this is a contract, it's a 10-year contract that sets out the programmes that we are working on over the next 10 years. We very much started on supporting the elderly population, and had some really big programmes, really sort of supporting people to live in the community independently. We've now expanded and very much looking at more prevention and the whole population. And also really sort of looking more at our inequalities in the borough and how we can use the partnership that we've created to really sort of tackle those inequalities and develop a better and stronger sustainable health and social care system. Next slide, please. So really, because of the work that we've been doing in Croydon over the last few years, we've already, really developed quite a lot of the partnership working within the voluntary and community sector. But it's definitely one area that we want to grow. And moving into prevention, this is where the development needs to happen. And it's been actually a really interesting journey working with the NHS, who don't really didn't really understand what voluntary sector meant and kept referring to volunteers. So we've really had to educate some of our NHS staff on what actually can be possible within the voluntary and community sector, and how important it is to develop those relationships and joint initiatives. And that's where we'll see the improvement for our patients. So we were really successful about 18 months ago to get a small pot of funding from the King's Fund to help us build on the work that we've been doing in the Alliance. So the funding has been allowed us to sort of engage more with our voluntary and community groups on how we can develop the partnership working across health and social care, and to develop those prevention services to support the health and well-being of our local communities. Next slide, please. So over the past 18 months, we've had a really wide engagement programme, working, as I say, with all of the partners really on what it is that we want to achieve with the Healthier Communities Together, what was important for our voluntary sector and statutory. And I'll just sort of pick out some of the sort of main things really that people wanted us to concentrate on. So there's a real ambition about making sure that our residents and community are right in the heart of all the service redesign, but it not just being when we wanted to redesign something, but that it was an ongoing basis. It was something that happened all the time, and that, you know, they were empowered and would, you know, take ownership of what we would call our sort of commissioning plans, and something that they would draw up and own and work with us on implementing. Another big thing, as I've sort of talked about, is about creating that community prevention offer, and it being, you know, the frontline offer would be both statutory and voluntary, working together. And obviously for us to do that, there's got to be a shift in funding. And this is, I think, one of the things we've been working on. It is quite ambitious, but we are looking at how we can, you know, shift some of the resource from our acute into the voluntary sector, so that we can, you know, really develop the offer of prevention from the voluntary and community groups. Another big thing that came out was to ensure that voluntary groups have a really strong voice within our governance structure. So we've done very well in Croydon, within One Croydon, of developing a very strong governance structure, and with the ICS coming in, we've been doing a lot of work to ensure that it's not just one or two of the big voluntary sector voices, but that we create a governance that allows the grassroots organisations to have their voices, and beyond some of the big boards. So there's some of the big things that have come out. I'm now going to pass you over to Bianca, who's going to give you a bit more of an overview of the work streams that we've got within the Healthier Communities Together. Thanks.
Thanks, Laura. And next slide, please. So, so as Laura described, a really ambitious programme built on already strong partnerships, but coming together and setting that vision together was really, really critical in terms of us as partners all owning what we were trying to achieve and the ambition that we were trying to deliver through the programme. And we set about, you know, in true form following function style, setting up the work streams and the governance to mirror those kind of key areas of priorities that we were looking to deliver. So we've got a local voluntary partnership board, which is chaired by a colleague from the voluntary sector. And underneath that sits 3 work streams: empowerment and engagement, leadership and representation, and funding and commissioning. And they're responsible for delivering those key ambitions that were set out on the previous slide. So empowerment and engagement is really looking at engaging local communities in co-producing services and activities to really deliver that transformation that we're aiming to see. And that is chaired by BCS colleague. Leadership and representation, again, you know, picking up on what Laura said, it's not just about kind of where voluntary sector organisations and relatively large voluntary sector organisations sit in our existing governance structures, but it is also about ensuring the voice of smaller groups get heard within the programme, but also in the wider health and care system. And then the funding and commissioning work stream, and that is the work stream that I co-chair with the Director of Commissioning from the CCG, or now the Place Base, in Croydon. And that is where we have been looking to develop our locality commissioning model, and we've also been looking at other ways of working differently with the voluntary sector to not only kind of shift the resources, but also about some of the responsibility around commissioning. Next slide, please. So breaking then down those kind of ambitions into kind of a series of agreed actions, in each of those work streams, we set about establishing what our activity was going to be and what we needed to do to ensure that we were delivering the vision at the end of that 3-year programme. And there's some more detail here in terms of each of the work streams and the key areas that they set themselves kind of as actions to deliver by the end of the programme. And just to pick out a couple of the key ones from my perspective, in terms of the empowerment engagement work stream, there is a real focus there around outcome metrics. So, you know, outcomes-based commissioning has been around for a long time, hasn't it? But actually, you know, really specifying good outcomes and delivering good outcomes is quite a difficult thing to measure. And whilst we really didn't want to, you know, spend the next year talking about outcomes measurements, it is also really important that we do understand, you know, the outcomes that we're delivering for people. And I liked a lot of the metrics that Plymouth were talking about, actually. So we're definitely going to probably steal some of those. In the leadership and representation work stream, you know, one of the key bits for me was around the leadership training and development for VCS leaders. And we have seen some local alliances forming in the voluntary sector in Croydon. There's one, a really strong one that's just kind of formed and is getting up and running in relation to mental health provision. But a real ambition amongst, you know, the bigger voluntary sector organisations to develop some of that kind of systems leadership with some of the smaller organisations in Croydon. And then in respect to the funding and commissioning work stream, so that's the one that I have responsibility for. There were two key areas that we sought to develop and deliver in that work stream. One was around our locality commissioning model, and the other one was looking at where our current spend is in the system and how much of that is currently delivered by the voluntary sector, and what the opportunities there are for the voluntary sector, you know, working with us to commission and also to deliver other services. So in respect of the locality commissioning model, that is something that we have been, you know, really excited by, and I'll come on to talk about that in a little bit more detail in a moment. Just in terms of where we've got to with the spend analysis, so as a system, you know, one of the ambitions of the programme is around, you know, the transfer of that resource, and it's not only the finance, it's not only the money, it's also the power, you know, the delivery. So, you know, that's one of the key ambitions of the programme. And obviously to understand, you know, how we were delivering against that ambition, we also needed to understand what our current position was. So we undertook spend analysis against all of our health and care spend as a local system. And we broke that down to understand what proportion of that is in scope potentially for being delivered by the voluntary sector, should they wish to deliver some of those services or some of those outcomes, but also how much of that that's in scope actually we are currently commissioning from our voluntary sector partners. And just to give you a bit of an idea of the numbers, of our total health and care system spend is about £728 million. 15% of that as a group we worked through, and it was, you know, as a group of partners we worked through that and deemed about 15% of that to be in scope for potential delivery or co-commissioning with the voluntary sector. And of that 15% in scope, only 11% is currently commissioned with the voluntary sector, of which 7.5 of that is with the local sector. So again, Laura talked about, you know, a real vision in our acute sector, to think about how we can shift resource and some of that power into the voluntary sector. And as you can see from those numbers, there's significant opportunities for us to do that, and that's part of the programme that we're working on next. Next slide, please. So it would be remiss of me not to mention that, of course, there are challenges. As I said, you know, the One Croydon Alliance is a really strong partnership that's been operating for a number of years now, and actually that gave us the basis for, you know, developing the healthy communities together. Actually, the programme developed quite well because we have those really strong partnerships already locally, but we can't deny that there are some challenges, and not least the funding position of our statutory sector partners is an ongoing challenge. Certainly in Croydon, we've had to deliver quite a significant amount of savings in the last financial year, or this financial year we're just about still in, aren't we? And that will continue into the next financial year. And of course there will be, you know, some impact as we look at decommissioning on our voluntary sector partners. So holding that conversation at the same time while we're working really hard with them to look at opportunities for them taking on, you know, further resource and responsibility has been quite challenging. But actually, as a partnership, we're all really committed to the medium long-term vision, and recognising that whilst we're having to take some difficult decisions in the short term, actually we've got to keep sight of that medium to longer term vision and keep doing all the work that we are through the programme to get us there and to be able to deliver that. And you know, there are, you know, ongoing issues about, if I'm going to be completely blunt, our ambition is bigger than our budget. So you know, a lot of the work that we've been wanting to do, and our voluntary sector partners are really keen to do around the development of those community hubs and engagement with community groups, obviously do require a level of resourcing, and that is in excess of the budget that we've currently got in terms of developing the programme. So so there are ongoing conversations about, you know, how we balance, you know, our ambition with our resource available, and you know, as partners, we're constantly looking at how we identify additional resource to be able to contribute to the budget so that we can really fulfil our ambitions. And next slide, please. So we've set out again in each of those three work streams some of our current achievements and where we're looking to go next. And I just wanted to draw on a couple of more of those, and I am really conscious of time, so I'll try and keep this brief. Going back to Laura's point around you know, engaging communities and it not just being when we want something from them. I'm delighted we've got our community partnership events now that happen in each locality. And that is ongoing engagement. It's not just when we want to go and talk about something. The agendas are owned by those local community partnerships, and we ask if we can go along and join them when we want to go and have a conversation about something. So you know, that feels really exciting. It's very grassroots. It's people in the local community coming together to talk about what's important to them. Just to touch on the locality commissioning model, and I think this is possibly one of the things that I've been really proud to be working on. It is about working with our local partners in the voluntary sector at a locality level, but also working with those local communities to determine what outcomes they want to see at a local level, and what services there are currently available and what commissioning we want to do at a very locality level to deliver those really good outcomes for people. So it's very person-centred and very community-centric in terms of developing those commissioning intentions, but also putting the community at the heart of commissioning, which comes back to, you know, that point about relational commissioning. We are working at the moment to shift the resource. We've identified a pot of funding that we're going to be putting into that locality commissioning model, and we're working with our community and our local voluntary sector to work through the detail of how that could work in practice, but essentially shifting that power and resource into the voluntary sector and into the community for them to be able to lead on that commissioning. So I think you know, really exciting. We are at the beginning of that journey. We're just testing it out and piloting in one area at the moment, but we're really hoping to prove that kind of, you know, proof of concept and be able to roll that out. And as we do prove that concept, actually start to develop additional pots of money that can start to go into that locality commissioning model. So I think what I would, the message that I would leave with is start small but think big, and that's really what we're trying to do in Croydon. Thank you.
That's fantastic. So much. Thank you so much, Bianca and Laura. Really interesting to hear the Croydon experience and the kind of parallels with what's going on in Plymouth. We're going to move now to Julian Blake from our E3M partner Stone King, and Julian is a public benefit lawyer with a kind of expertise in this area, and we're going to hear from Julian about ways that we can develop more relational approaches to contracting. So over to you, Julian.
Awesome, thank you. So I'm going to be talking about the mechanics of commissioning, relational commissioning and contracting, so the legal mechanics. And I'm going to focus more on the contracting part than the commissioning part. You've heard very good case studies of how the commissioning has been collaborative and purpose-driven and relational. I'm going to talk about how the legal mechanics can assist in that and facilitate that. So mainly I'm going to be talking about the contract itself. We've spoken in E3M events, almost every E3M event over the last 10 years, of the issues about procurement not really assisting collaborative endeavours like the ones you've been hearing about. The toolkit that Jonathan's mentioned has 5 fundamental correctives that we suggest would assist in relation to public benefit commissioning, collaboration, purpose, public benefit focus, social value, and the relational rather than the transactional. So that's what I'm really going to be talking about, which really means about pursuing the purpose and the purpose alignment between the public sector and the public benefit sector, and doing so on the objective principle, which puts you, Rachel, I would say, well within the legal boundaries. It's just that that's not always obvious from the way entrenched practices continue. The Plymouth phrase that I remember that illustrates that is that the Alliance contract came out of being thoughtful rather than being routine. The E3M phrase that's very similar to that is that purpose should prevail over process. And what all of that really means is professional commissioning is what's required. But as I said, I'm really going to move away from the procurement bit and the commissioning bit to the contract bit, because that can help with the shift of mindset in quite a significant way. And I'll illustrate the point by giving you 2 examples that have come across my desk in the last week or so, actually. The first one from central government. It's about developing educational policy in quite a developmental way, so it's not obvious what exactly is going to be happening. This was a contract of 120 pages. 120 pages contained literally nothing that was relevant to the contract, because they were 120 pages of standard commercial contract drafting. They then had about 10 or 15 additional standard schedules that were added or not added. And there was literally hardly any attention given to the actual specification, or even, unbelievably, the contract pricing. So that was maybe 200 pages worth of documentation that was pretty useless. And similarly, in the last week, I've received one actually in quite a similar field to the case described by Croydon. I mean, another region, elderly support to the elderly services. That was a 75-page standard contract, again with schedules that came or were opted in or opted out of. Again, none of those paid much attention to actually what the contract was about. So that's kind of standardization, that type of commercial drafting is totally antithetical to relational engagements and collaboration. This for me goes back 30 years, over 30 years. The first public service contract I saw, I just couldn't believe the form of it. It was just a commercial contract without any adaptation to the subject matter of public services. And as I've just described, the situation hasn't got much better. So what is a public service contract? Well, it's not a commercial purchasing contract. That's why the commercial model is not necessarily the right approach. It's a commissioning contract. It's about realizing the purpose of best value public services. And when we're talking about engaging with the public benefit sector, we're talking about the mutual focus on those best value public services, which means we're talking about collaboration, we're talking about relational engagement, we're talking about, let's call them working agreements or collaborative working agreements rather than contracts, which would help us move into the right territory. So the public service working agreement needs to articulate the agreed mutual intentions, and they need to provide the facilitating framework for the realization of those intentions. And that means the critical points in the contract against the commercial convention are, number one, Focus on the specification, a detailed, careful description of the intended services, activities and outcomes. Actually, that is a proper part of the contract, but as I've described it, often now is being submerged beneath pages and pages of standard stuff that don't really relate to the specification. Specification number one. Number two, communication. And you hardly ever see anything about communication in commercial style contracts. The detailed, careful description of how providers and commissioners will engage to maximise the realisation of the intended outcomes. And that leads us to contract management. Contract management not being about enforcement and remedy, and in the extreme case, dispute resolution provisions, but being about support and flexibility. And as Mark was suggesting, recognising that there may be difficulties, there may be issues to resolve. So you have processes for addressing issues as they arise, or you anticipate them. You don't wait for them to develop into disputes. You don't even wait for them to develop into disagreements before you're trying to discuss them within the context of your relational, collaborative relationship. And on the multi-party type of agreement we're talking about, that communication starts with establishing your steering committee or your project committee that will work like a board for overseeing the whole project. So what we're really talking about is these working agreements mean that you're recognizing that in social environments, public service environments, the major parts of the delivery aren't about a service that will be delivered and can be verified. They're about the inherent uncertainty, the difficulties of these intractable issues that we're trying to address in better ways, progression and development and adaptation and learning and refinement and adaptability and flexibility within the relationship, within what is a contractual relationship, and all of that focusing, as again the examples illustrated, on the long-term development, not just a 3-year turnaround service contract. So further, it also means best value coming from balance between the perspectives of the parties, fairness to the provider, realistic pricing, including surplus consistent with sustainability, risk sharing, as was coming clearly through the case studies, proportionate to resources, obviously, and that really is talking about the overall resources available being applied in the most productive way for the purpose. It also means, and this is the literal legal bit, that the drafting needs to be clear and accessible, which means simple as possible, proportionate, focused on the priorities, and that's not really the way commercial contracts are written. So here's an example from a typical public service contract. You get 2 pages on anti-bribery when you don't really need 1 page to say nobody's going to be bribing during the course of the contract. We still have almost all the contracts you see, possibly even those in these excellent case studies we're talking about, written in transactional commercial form, because that's the only type of contract we ever see. And the assumption behind that style of drafting is that one is the best deal for one party. It's not the best deal which will deliver the best outcomes for the beneficiaries and for the public, a mutual intent. The commercial concept is we get our best deal out of this contract, and that becomes a sort of negotiation, not a collaboration in the sense we're talking about. There's also a big issue about the public sector commissioning environment in the contracting subject, because the public authority has all the power. So it's very easy for the public authority to be prescriptive, to impose conditions that are unbalanced, that are unfair, that are not applied, that are risk avoiding, that are cost minimizing, and that are overwritten, all to do with managing theoretical risk for the public authority and not to do with realizing the best outcomes. That's all been compounded terribly by the way procurement has worked over far too long, where we don't get in the contractual part. There's lots of issues about procurement, but from the contractual perspective, it removed the idea that there's a discussion about the contract. It accentuated the idea that the contract terms and conditions get imposed upon the delivering party, which isn't the best way to create a balanced best value contract leading to best outcomes. So with the sort of contracts that come across my desk, I quite often advise that they're really not worth reading because they don't really help with the collaborative relationships at all. And what I'm really wanting to say here is that it doesn't need to be that way. You can produce the documentation that can facilitate the sort of relationships that have been described, that help those relationships, that support them, that make them work better. Now, the legal part is not the most important part. The sort of commissioning initiatives that you've heard about are by far the most important part. But a framework that actually makes sense and it actually articulates the intentions well and incorporates the flexibility and gives a framework for how discussion works and how issues are raised is going to be very helpful when it comes to supporting these collaborative arrangements. These working agreements, these purpose-driven, balanced, fair, clear working agreements. You very rarely see them, but we should change our practices so that we see them all the time. I'll give you a few examples of how this better practice is developing. So what you can do, what I can do, I can't do much about the imposed contract from unreconstructed commissioners who just put out standard terms without really thinking about them. What I can do is at the subcontractual level say subcontractors don't need to behave between each other in that same way. They can edit down what they've received. They can risk share the imposition. They can act reasonably and fairly between themselves. And in that way, you can establish a better sort of collaborative, productive, relational approach within the subcontractual arrangements, even though that's not what's happening from the principal contract. You've heard about really excellent collaborative models. Obviously, they need more applied focus because you've got to work out how the different parties interrelate. You're not just talking about two parties. We've talked in E3M a lot about innovation partnership in that sense, and multi-sector, multi-stakeholder community partnerships. And of course, you've got the example of the alliance contracts that Rachel was describing. One slight step forward I was quite pleased about in the social impact bond model contract, which was drafted, I don't know, maybe 8 years ago, something like that. When that first was going to happen, I said, you've really got to focus on making this a relational contract because you've got providers, commissioners, and social funders who all need to collaborate to the common purpose. Unfortunately, it wasn't really written as a relational contract, but it's just been rewritten. There's a new version of it, and I was able to get involved in that again. And I said, look, really, you've got to focus on how the three different perspectives interrelate here. So there is a schedule now which talks about the interrelation of perspectives. It's still quite a commercial model, but it's recognizing that the essence of public service engagement is about these relations being established and being effective. The point was also taken by Danny Kruger MP in his report on levelling up, which led to the idea of a new social covenant. He takes the point that what we should be focusing on is working agreements in that report. We wait to see how much levelling up will follow through on that. So we're talking about requirements for relational contracting and commissioning, professional, applied, commissioner-led drafting, focusing on those two core elements, the specification and the communication. We're talking about the lawyers who are charged with drafting these documents, being purpose-driven professional drafters, not taking standard documents off the shelf effectively and just being driven by the risk cost minimization factors. And what I would say, and it's illustrated in a way by all the description you've heard so far, if you were to say, let's focus entirely on the specification and entirely on the communication and leave the legalistic framework to one side altogether, or you were to say, as so many public service contracts do, let's focus for 120 pages on the standard legalistic stuff, which of those would be the better contract? No doubt at all, you can have the specification articulation and the communication articulation in a document that doesn't have any legal component whatsoever, and it would be a far better contract than those 120-page documents that we have to deal with at the moment. So it's all about getting the specification focus and the communication focus into the documentation, which will enable them to facilitate and support the sort of projects you're hearing about. And then you would have reasonable, fair, balanced, facilitating relational frameworks, which is really what the best definition of a contract is. But let's call them working agreements.
Thank you, Julian. Excellent. We'll just have to hope that we get some colleagues across the legal services of various local authorities taking some of that on board. It would make a huge difference to making things work. I'd like now to hand over to Councillor Louise Gittins, who's the leader of Cheshire West and Chester Council, which happens to be a cooperative council. And we'd love to hear your perspective, Louise, on this and some of the things that you're doing.
Thank you very much, and hello everybody. As Jonathan has said, I'm leader of Cheshire West and Chester Council, and we're really proud to be part of the Cooperative Council's Innovation Network. Just a little background about Cheshire West for those who don't know it. A lot of people think we're a lovely green, beautiful county, which we are, but within that there are a number of challenges that we face. So we are actually the fourth most polluting borough in the country. We have a number of really heavy industries. We've got SR, CF fertilizers, Vauxhall Motors. So we have a big challenge around pollution. We also have a number of areas of deprivation. So we currently have about 78,000 of our residents who live within indices of multiple deprivation levels 1 and 2. We've also got a rural community as well, and with all the challenges that come round of that. So in 2019, when I first became leader, we put together a council plan that was around building stronger communities. And within that plan were a number of golden themes or threads that ran right the way through around climate, emergency, poverty, and mental health. And we really wanted over the next, well, this 4 years to drive forward around building that theme around stronger communities. As a council, we provided and commissioned a range of different services. But what we wanted to do was to change the way that we commission. And so I thought this afternoon I'd just take you on the journey that we've been on over the last few years. And I have to say, in 2019, I think I got a feeling that it was in the too hard to do box. And we knew that as politicians, if we wanted to drive this forward, there was a lot that we needed to do. Next slide, please. All my slides are stuck. There we go. So 2020, the pandemic came along, which impacted all of us. And actually, that too hard to do box became the has to do box. And it certainly changed the relationship, as it will have done across all local authorities, between the council, the NHS and the community and voluntary sector. And it changed because all of us came together with a shared and urgent priority that we need to deal with. And because we were in such a big sort of state of emergency, it meant that the decision making was streamlined. So we all worked together to find solutions. And I think that really started to change the way that our relationship was with the both the NHS and the community and voluntary sector. As everyone we saw local communities stepping up and registering to volunteer. We set up our own system for volunteering alongside the NHS one, and we got over 2,000 people that put their names forward to volunteer and help support that community effort. And we work very closely with our community and voluntary sector in linking those volunteers with different organisations across the borough. And what we found was that we needed to share information, our skills, our capacity and decision making. We all became almost overnight equal partners. And this different relationship that we built during the pandemic showed us just what could be achieved if we worked together after the pandemic. During that time, we set up a community fund. So we put £250,000 into a community fund, and that was matched by the Westminster Foundation. And rather than having a big process for community and voluntary groups to apply, there was a very simple application that they needed to do to bid for money or to apply for money to support their communities during the pandemic. And I think when we look back at learning from the pandemic, one of the things that an officer said to me was the biggest thing for her was learning to let go and learning to say yes. So we use that as sort of a way forward for us to build on. And I want to talk through some of the things that we've been doing since. So the next slide, please. So the next slide you're going to see is a lovely heart with lots of pictures of children in it. There we go. So this was our holiday activity fund programme. Lots of councils doing this, but we wanted to do it in a slightly different way. So our holiday activity fund is run by Essential, which is one of our council companies, but it's done in partnership with the Welcome Network, and this is done right across Cheshire West. So the Welcome Network is a food partnership between ourselves and the community and voluntary sector. Within our council, it's led by our public health team. And the Welcome Network is currently developing a food charter, and they're sharing good practice and collaborating, and in particular making the most of their collaborative skills and funding opportunities and resources, with an aspiration for Cheshire West to become a sustainable food place. So our holiday activity fund enables kids on free school meals to access healthy food and to take part in lots of different fun activities over the school holidays. And last year we had 120 community, voluntary and faith organisations accessing the fund. And I think the key to the engagement with this was streamlining the access to the funding without any bid requests required. And this has led not just to activities around food, but a real enrichment of activities, things like visits to Chester Zoo, hairdressing, forest schools, hiking, and lots more. And one parent said, it's really helped as I have 3 daughters and I'm not always able to do activities with them. This kept their minds and bodies on the go, keeping them active and well. They really enjoyed it, and I enjoyed going to the sessions with them. So our holiday activities are now going on throughout all of the holiday times, not just in the summer. So next slide, please. And this was how we built on that community fund that I described during the pandemic. Because there was such a massive response to the community fund, we've set up Cheshire West Crowd, which is a crowdfunding site run through Space Hive. And this is where residents and local groups can propose projects and request funding. And there's also opportunities to attract funding from their communities, from the council, local businesses and foundations, all in one single portal. So we put in £200,000 to fund a number of community projects that aligned with our council plan around climate change, suicide prevention and tackling poverty. And 27 different projects were funded, and currently there are 8 that are currently on our site seeking funding. And we've just closed the cut-off date for our second round of funding. And the types of projects we've had are things like there was a community films being made, a refurbishment of a community centre, helping to provide a segregated cycling and walking path. So lots of different projects that the community is now delivering based on our council plan. And I think all of this has helped us to actually build our relationship with the community voluntary sector and build that trust as we move forward with our ultimate aim of doing commissioning in a different way. So the next stage, and if we can go on to the next slide, is our compact. And it was interesting hearing from the other councils, because you seem to have similar sort of things. And we had a compact with the public sector and the community sector that was signed many years ago, and it was if you still had dusty drawers, it would be kept in a dusty drawer somewhere. But we decided that based on the work of the pandemic that we really needed to do something on our compact, and because of that the public sector and the community sector worked together to come up with what we think is a really strong positive compact that will put in step how we want to work together over the coming years. And it is our commitment to change the way that we work, and certainly our other public sector partners have made that really strong commitment too. And it's about building on the relationships that we've got and improving our partnership working. There's still a lot more to do, but I feel that it's really a positive step forward around that shared purpose, co-production, partnership and collaborative working. Working around the compact, the first thing that we did was the household support fund that the government introduced in the winter. We topped it up with our own local winter poverty fund, and the community sector were the key partner in terms of ensuring that that got out to our residents, building on all those strong links that they've already got. And this has enabled us to target resources to those in greatest need and the harder to reach communities. And it gave us the opportunity to learn more about the impact of funding and outcomes for our communities to inform future allocation of resourcing. And I think the next thing that we've now done, which is our next slide, is how we've changed our commissioning approach. And I'm really pleased that we've got here, because I think in 2019, it really was in the hard to do box, but I know that we're driving this forward. So in terms of changing how we commission, we're shifting the focus of commissioning away from a transactional process towards something that's more holistic, that's developmental and outcome focused, and an approach on building partnerships and understanding of what's needed and what's actually worked. And I think the confidence to do this, to build this different way, has really been through the trust that's been built up over the last three years. And I've heard that word trust coming out really strongly today, and building that sense of common purpose. And by taking a long-term view of the kind of services we need in the future and what kind of organisations we need to provide them. So this has strengthened and built new relationships to help with our market shaping. So for example, we've set up an adult social care commission, which is a combination of providers, industry experts, academia, and the voices of people who use services to help shape the future market and what our commissioning intentions will be around that. We want to create a commissioning environment which encourages, enables the community sector organisations to access and to be successful in all of our commissioning exercises. And we're going to use the opportunities we have within legislation to commission in ways which promote innovation, creativity and diversity in the market. I think we talked before about that locally based commissioning. I think that's really quite important, and we want to support very hyper local services. It's important that this is everything we do now around this is values led and is supporting the delivery of our council plan. And I actually know the guy that I'm going to mention next, and I noticed his name in the chat. He's the chief exec of the local community and voluntary sector umbrella group, and he sits on our commissioning board, which is developing in particular a forthcoming commission tender around community support as we look to make it more accessible. And he actually said in a meeting he can't actually believe he's sitting on the board, and he never thought it would get to a position where he could do that. And I felt really chuffed at that, because I felt we'd come a long way. So I think reflecting on where we are, I think, I do wonder if the pandemic hadn't come along, would we have, got this far in such a short amount of time, because we really were thrown together. I think that if we come together with that common vision and purpose and start co-producing the services and looking at that much more collaborative approach, I suppose the proof will be in the pudding, and our first big test will be on the recommission or the development of our community support service later in the year, and I'm looking forward to how that all pans out. But I'm feeling very, very positive, and I hope, Gary, sorry, if you're still there, I'll mention you. I hope you're feeling positive too. So thank you very much.
That's great. Thank you, Louise. That's fantastic to hear about the changes that you've been making up in Cheshire, Western Chester. And I have to kind of make an apology in that I've crammed this programme so full of things that we're not left for very much time for questions. And I'm aware that we've got quite a few. So the first thing I want to say is that we are actually going to be organising a really special event. It's going to be our first face-to-face public event that we've done for over 2 years, and it's going to be all about harnessing the potential, or the full potential, of social enterprise for public services and meeting local needs, with lots of examples and speakers from the toolkit. Rachel's agreed she's going to be there. We'll have a few other people that will be there, and it's going to take place on the 25th of May in London, and there'll be some more information about this shortly, but there'll be the chance to get into some of the detail there. And we'll also have a go at answering as many of the questions and getting back to people as we can afterwards. We can send them to you. What I'd like to do is to finish by asking, there's a question from Tina Holland, who I know works for the LGA, and she was interested in the sort of one thing that maybe you could say that's really made a difference to changing things, to changing the culture or the way of doing things, or getting out of this kind of siloed, old-fashioned way of working. So I don't know who would like to kick off with that. And I don't know, hopefully,
oh
yeah, is that you, Bianca? Yeah, fantastic.
It is, yeah. I'm sorry, you said one, I'm going to give you a couple, but I think from my perspective, in the conversations that we've been having, it's about, you know, a level of honesty about what the art of the possible is. And actually there was a lot of learning that we did as partners together to understand each other's position and perspective. So for example, and that, you know, I totally take the point about, you know, not being driven by procurement regs. I would absolutely agree with that. But, you know, there was a point about being really clear about what a local authority was and able to do, and therefore it dispels some of those myths that actually there was a holding back. So I think there were some really honest conversations that we had with partners, and also, you know, with our voluntary sector partners being really, really honest about, you know, the level of risk that they wanted to take on in terms of doing some of that kind of co-commissioning. So I think that's been really important in the journey we've been on, and actually makes us a stronger partnership as a result. And I think the other key bit for me was about putting the money on the table and being, you know, really clear about where the money was in the system. So that spend analysis I talked about, because again, then it meant we were all on the same page, we all had the same information, and it kind of balances out some of that feeling of, you know, inequity of power. So for me, they were the two key things.
Mm-hmm. I don't know, how about Mark or Rachel from Plymouth?
Yeah, I suppose similar, but it is about having those honest conversations. So yeah, similar. But I think we started from, I mean, certainly with the Complex Needs Alliance, started from the point of view of just talking to people about their experience of their lives, of what was happening to them, but also, so it wasn't asking people about services necessarily, going around that sort of loop of what do you think about the services you're getting. It was actually about asking people about their lives and their experience. And similar with the Wellbeing Hubs, I guess, about their communities, rather than thinking what can we do to fix their problem, because you just end up designing new services. Then it's about actually what is the issue, what are people's lives really like, and what are the issues, and then starting from there. So it's taking that conversational approach.
And Louise?
Yeah, I think having that shared challenge, it was certainly during the pandemic when we had to come together and we had to talk to each other, and you know, and I think it's around communication, isn't it, and getting to know people. I think it's really important, and sitting around a table, even if it's a virtual one, and understanding where everyone's coming from. And I think I think the more you can talk to people and communicate face to face or virtually face to face, the better it is, rather than emails and things like that. So I think having and building that sort of relationship of trust.
Julian, can you see one thing?
I can. I'd say it's courage, illustrated by participants in this webinar, because 10 years ago we were in an absolutely desperate state of process driving purpose and purpose almost being lost. And what that required was people with responsibility recognizing that these entrenched approaches were not focused on the right things, and going beyond what very many people were saying is, we can see these things aren't right, but nobody else is doing any different, so we can't do anything different. So the pioneers who actually have the strength of their conviction and said, this isn't working, we've got to do something different, even though everybody else is still doing the same thing, have made a very significant difference and continue to do so.
Thank you, Julian. Mark, did you want to add anything?
Yeah, all I would say is I think there's a challenge which I just want to move on to, which is that good relational relationships, if you like, with your commissioners and with takes time and it takes effort, and that time and effort is going to be squeezed even more in local authorities in terms of the amount of work that people are being given. So I was looking at Louise and listening to her. The key for us is COVID has shown, it's moved some authorities whereby they've had to do it, let's be honest, because they realised they had to get a response quickly. So now that it's seen its work, I'm just really hoping that councils will look at how it's worked and enable the officers to be given the time to continue those relationships. So like you said, Jonathan, you're holding an event in May, face to face, that's a whole day, people will be out, but it's so important because that's what will drive this forward. If we go back into silos, that's my only concern going back to Julian, is I just hope we don't miss this opportunity because of short-sightedness by councils looking at resources and going, if you're going to get Rachel and others to do this, you have to give them the time to build and continue those relationships.
Yeah, I would certainly agree with that. And we are now really out of time. So I would like to say a huge thank you to Rachel, to Julian, to Mark, to Louise, to Laura and to Bianca for what's been a really fantastic session this afternoon. We do actually have a case study of the Plymouth Alliance in the toolkit on the website, and that might answer one or two of the questions that people have on that if they want to kind of dip into it. And there's some interesting video clips from some of Rachel's colleagues as well about how that works, and also case studies of some of the other things that we've looked at in the past, like the Oldham Social Prescribing Innovation Partnership and the one for Children's Services in Plymouth. And we will be developing more stuff for the toolkit to try and support sharing some of the pioneering work that you guys are all doing to support others in that. And we're very pleased to be part of the Cooperative Council's Innovation Network as an affiliate, and to try and share some of the work that we're doing more widely through that, as well as the work that we're doing in E3M. And we will very soon have some information on the website about the event in May, and I really do hope you can come and actually take a bit of time out and spend a little bit of time working with social enterprises and some funders and bold commissioners from around the country in looking at ideas that you can then sort of take back to where you are. So thanks again to all of our speakers, and thank you all ever so much for coming today, and look forward to seeing you again really soon. Bye bye now.